Hey, this is Willie T, and this is episode 2 of CybinSpace. We're going to be discussing facilitation and what that looks like in this episode, and we got some great people on our panel to help us discuss it. We have over here Anthony Kawaii. We have Matt Whistler in the building. Jeanette Smalls back with us. And Paul Stanford. On our Zoom call, we have Jana Champagne and Heather Shelton. Today we're going to be discussing the facilitation and what it took to even get there. But I think it's really important to take it back to the beginning. You know, in the 60s, psychedelics really blew up. There was a lot of anger towards this, a lot of fire trucks showing up and spraying people down and shutting down head shops and stuff. And, in keeping that alive, in keeping those head shops, that's how I got into this industry, was with head shops. It kept these things alive. It kept these discussions happening. It kept people having these experiences. And in having these experiences, we've been able to share it with more people so that we've been able to open up minds and ideas and allow for the votes to happen. Paul's been there ever since the beginning. I love some of your insights on how it got all started.
Well, there were other people there when I got started. I don't want to say it was the beginning because the beginning is way in prehistory when the caveman first found the cannabis plant, if you want to call him a caveman, or the mushroom. I mean, mushrooms are integrated into all different indigenous communities. That's the beginning. But in terms of our present day culture, I got to meet Captain Ed Adair in Van Nuys Boulevard in Los Angeles, and he introduced me to Jack Hare, and they were working to legalize marijuana. And they said they were going to keep working at it until either it became legal or they turned 80. Neither one of them made it to be 80. And it became legal after they both had passed, but their legacy lives on through us. And so that's the way I see it.
That is true. And, when we were graduating through the Changa Institute, we did our in-person training next door to the Third Eye. And we were doing breath work. And just breath work, being next to the Third Eye, I seen, glass dragons floating in the sky from just breath work. And it was a very moving experience for me personally to be so close to the fighters and the people who have continued, this struggle, keeping this, a topic that can be had. And so just thank you for keeping it. How many episodes have you done?
In terms of my Cannabis Common Sense show, we've done 1,170 since October of 1996, and we're still doing that. I should just tell your audience don't know the significance of that shop, the Third Eye. That was opened by Jack Hare here in Oregon back about 1986 or so, and run by his family until recently.
Wow. Yeah. Great. Lots of history. We got to remember the history where it comes from. People say the underground, this was truly the underground. This was truly the people taking the risk to make it happen. So today we want to discuss facilitation and what that mainly looks like and how psilocybin can help benefit yourselves. So, Matt, would you like to discuss what you do?
Yeah, well, it's a multi-step process. So if we have a client who comes to us looking for psilocybin facilitation, really the first thing we need to do is figure out what their intentions are. Why are they seeking out this service? And help them kind of parse that out and internalize their intentions, because a lot of the times what people get out of these experiences are often reflection of what they bring in with them. So that's really just the basis, and there's an extensive preparation process that clients really need to go through, and I think as facilitators, the preparation is actually the most significant part of our job, really. I have had clients tell me, after a session, that the preparation really helped them get through the challenges as they arose. And so if we do our jobs as facilitators properly and really prepare the clients for the experience, then our job when they're in the experience and sitting with the medicine just becomes that much easier, both for ourselves and for the clients. There's not going to be a lot of surprises, and if things come up that may be challenging or even slightly overwhelming, they'll have the tools that they need to deal with that and move through it and even take positive insights away from that.
So there's really three parts to this, right? There's, preparation, there's, administration, facilitation, and then there's integration. What's some of your thoughts on this, Jeanette?
Well, I think one of the things that is important to mention in kind of how the legal framework is possibly looking a little bit different from what has been happening up until now is that we're getting different clients. A lot of the folks who have been utilizing psilocybin have been utilizing it in a framework that forces a certain type of person to select for those services. Now that we are in a legal framework, more people are able to utilize those services. And so we're seeing people coming in with different intentions, with different paths that they have already walked. So the facilitator really, as Matt was speaking to it, has to do quite a bit of preparatory work in making sure that we're understanding what brings this particular client in to this particular intervention, to this type of a treatment. We need to really understand what they're coming from and what it is that they're seeking to achieve. Right. And that is a little bit of a challenge and also a great opportunity for us.
When I originally started this journey, I was doing a lot of interviews with a lot of people who had experiences. And I always found when I would meet people, there were people who had an experience, they sometimes overcame something, or they just had a fun experience. And then I met people who were definitely like, I tried it once, that was the scariest thing, I'm never doing it again. Being somebody from the underground, I kind of wrote on that in my schooling because I kind of seen that practice happening out in, it starts with, you eat one or two and you enjoy yourself and you have fun, with your friends. And then maybe you have a dose that is a little intense, does bring up some, past things. And that tends to be, the bad trip. I believe it was Timothy Leary. He wrote the book on this. There's no such thing as a bad trip. It's just, telling you got some things to work on, and you might want to work on those so you can have a good trip. And that, I think that's where the intentions come in, and the integration for this and how it connects with our minds and everything. I love the study of Robin Carhart Harris. I don't know if you guys are familiar, but he does a great study on the brain and our neural pathways and how our neural pathways open up under psilocybin. We have a default mode network that just kind of trains our bodies to consistently act out, like it teaches us how to drive a car or walk down the street. And psilocybin opens up so many pathways in our brains that, different parts of our brains are talking at different areas. And that's why sometimes we can perceive, very visual or audio things. Like in DARE, when the DARE officer came into my class and said, hey, under these drugs, you could, smell colors and hear feelings. Sign me up, And I've been looking for that drug ever since. I haven't quite found it yet, but I've had some great experience personally with psilocybin that has been able to, achieve a different way of thinking. And for me personally, when I was interviewing people, I always ran into a common thread of empathy. And I think that's where the neural pathways opening up in our brain during a psilocybin session helps people have that empathy for a situation that they've had in their life. And would any of you guys like to speak on that?
Well, I'm an herbalist, and I specialize in creating herbs that affect what's known as our endocannabinoid system. And so I believe, right, that our endocannabinoid system, we are able to clarify a lot of things. And what really brings into the light is that mushrooms, especially psilocybin, helps to stimulate this endocannabinoid system that we, right, are trying to find the connection between human and plants, right? And so this endocannabinoid system brings us closer, and it helps to open up new ideas, new ways of seeing things. We need to clear our minds, right, in order to find real change, inner change. And mushrooms, right, and the stimulation that it has with our endocannabinoid system will bring that change. It will bring a mind and a body change and bring them back into an alignment, right? It's known as a homeostasis state, right? To where we are bringing our minds and our bodies back into an alignment. And so, understanding, how mushrooms affect us is really what we need to come to terms with. Legalizing it and also bringing it to the forefront is one thing, but understanding how it's working and how it is affecting us is really where we should put some attention into, and coming up with different types of ways to stimulate it. So, which will help us, right, to clarify our minds, clarify our bodies, clarify our way of seeing the world, and help others, right? Because really this is what the journey's about. So
it definitely is. And two, I think for the longest time there was so much, fear mongering behind mushrooms. I think it's just kind of, been, indoctrinated into us to fear mushrooms because there are so many mushrooms out in the wild that you can't eat, Matt, any ideas?
Yeah, well, one of the things that you were saying that really struck me was about psilocybin helping, and other plant medicines helping bring things into alignment. I think one of the most common outcomes I have with my clients is they come into a session, they have their experience, and when they're leaving, the impression I get is they're like, that was really hard, that was difficult and challenging, and I'm not sure if I got anything out of that I didn't already know. And it seems like there's this little touch of maybe disappointment in there. But I always give a few days before we do our first real big integration session. And when I get back in touch and we do our integration, they say, well, even the things that I took away from that experience weren't things that I didn't already know. I find I'm living in a way that's much more in alignment with those truths, and I'm interacting with the world around me and with other people that's much more in alignment with those inner truths that I got in touch with. And so people may come looking for a big mystical experience, but I honestly believe that what we get from the medicine is oftentimes what we need the most at the moment. And a lot of times what we need the most is to live in a way that's in alignment with our inner truth and our higher selves. And so if we're not doing that from the get-go, the first thing the medicine is going to do is say, hey, get in alignment with your truth. And then maybe once you do that, we can move on to the other higher spiritual things. So,
definitely. And the thing is that we can integrate herbs, right, into this endocannabinoid system. There's so many things that we can do now because of the existence of this endocannabinoid system. We can figure out the connection between spiritual and human. We can figure out the connection between how we are being stimulated, right, in many different ways that has to do with cannabis, that has to do with mushrooms, the connection, right, was really hard to put together. But now that we have this system, right, it really is the missing puzzle piece. What we are trying to achieve is something to where we are looking to a total body change and a total mental change, right? And in order to do that, we cannot just focus on one system, right? We need to focus on a system that focuses on all systems. Now, the endocannabinoid system is that system that regulates all other systems. So, stimulation is very important in order to create change, right, within ourselves. And, I correspond health between humans and plants, right? We intake the same type of nutritional intake to survive, right? Nitrogen, phosphorus, potassium, right? And we also have the same pH balance, you know what I'm saying? So when I was a plant grower, right, for 15 years, and so I'm always utilizing on bringing life back into plants. And how I do that is I treat it just like how I would with a sick individual. you know, because I understand that it takes patience and it also takes a hand that knows how to be gentle with it. Now, when we integrate that, we can also integrate the change into ourselves as well by integrating that idea, right, of bringing our ideas from the forefront when it comes to cannabis and mushrooms to the stimulation of how we are being able to change ourselves from within. So stimulation through our endocannabinoid system, through herbal medicine, will help to bring focus and clarity to our lives and to where we can change it, you know. Stimulation of chemical balance is really important. So
I think now would be a great time, too, to introduce our Zoom callers. We have Janice Champagne and Heather Shelton on the line, too. You guys want to share some thoughts on this subject of the endocannabinoid system?
I'm going to go first, Heather. I think I went first last time.
Sure. Yeah, you know, first off, I just want to say I think cannabis and psilocybin both really offer us a shift in perception. And in fact, my work with cannabis, you know, I work primarily with people living with cancer, so it's kind of a little more in-depth work that I do. But one of the things I think so incredible about this plant is that when primarily with inhalation, I think is the best method too, it offers us the shift of perception where suddenly we can be here now, right? Mm-hmm. And when we're here now in the present moment, we really are able to experience gratitude in a different way. And so that's one of the gifts that I really feel cannabis offers us. And I see this in the work with psilocybin as well. And I just want to go back to, I think Matt was talking about preparation, and preparation is so important. And preparation is really when the integration of your experience begins. And so some of the things that we like to offer in preparation are tools, you know, just tools that we can already start to use in our everyday life to bring us more awareness to ourselves, right? Connect us maybe a little bit more to spirit. So, you know, in our Oregon program, folks are required to have one preparation session with a facilitator. And, you know, I don't personally feel like that's enough time. There are definitely some folks who are coming in, they've done a lot of personal work. Maybe they've already had some experiences with psilocybin or other psychedelics, and they are really in a place of readiness for this new experience. But, you know, this was also brought up too, is that now this is a legal opportunity and we're having folks from all different walks of life who are coming in and really wanting to have this kind of a shift and a psilocybin experience. And they're so grateful that it's an option and that it's legal, right? Yeah. Most of us, I think probably everyone on our Zoom call, like we've all had some aspect of our life where we've had to be criminal, right? Like we broke the law. We were trying substances before we were allowed to legally, in a sense. But not everybody is open to doing that, right? And so, you know, we've just had a flood of folks from other states and other countries, you know, who are interested in having these opportunities, but it doesn't mean that everybody's ready. Right. So the preparation piece is just really critical. In regards to the endocannabinoid system, I mean, I've had a couple of conversations with another friend, Barry, about this. And, you know, at this point, because we're talking about two Schedule I illegal substances, there's not a lot of research that's going to support this information yet. However, whenever we've brought ourselves to a place of more calm and our nervous system is more regulated, our endocannabinoid system is going to be functioning better. So I can see how it's certainly psilocybin can affect our endocannabinoid systems and bringing some balance to us, because in an emotional sense, or our mental health may be improved by having those experiences. Mm-hmm. So I'm looking forward to learning more as the information comes out.
I would like to, you really touched a point there that, you know, I'm going to discuss a little bit too, is, you know, that present moment. I think, you know, we don't give too much thought to actually what that means. And I'll never forget a life-changing moment for me was, you know, understanding that Whenever we're thinking too much about the future, that we're building anxieties. Is this bill going to get paid? Are these people going to like me? And when we get stuck thinking about, well, I wish I would have done this differently, or I wish I could go back to that moment when I was a kid and I had, bowls of cereal or whatever, we're living in a form of regret, and that's why we call the present a present. Because if we can find ourselves in these present moments, we're able to actually achieve, happiness. Because happiness is not something that can be, held, controlled, sold. It's only in these present moments. And I think that's the beautiful thing of most of, my personal experiences. Sorry if I covered my mic there. My personal experiences with psilocybin is finding myself enjoying my present moments and helping teach others to find that present moment. And I love that. Janet Champagne, you have some to add?
I'm sure, yeah. So, I just love too that, Heather, you're talking about the present moment, and I'll share a way in which cannabis has impacted my life personally. I have a 21-year-old daughter with autism, and she was pretty severe on the spectrum. She's doing fairly well now, but very minimally able to communicate, by verbal means. And so when I'm able to utilize cannabis and just be with her in that moment, that's sort of her operation system, is to be in this moment. And in this, the sensory and energetic, she's so sensitive. She's like an antenna, I tell people. So being under the influence of cannabis and being able to remain in that moment with her actually facilitates that connection with her. And I'm better able to kind of read her signals, and she can read mine. And it's just so beautiful to be able to just be with her under the influence of that. And I feel like our connection is so much stronger when we're able to do that. So, it's really about releasing the fears, like you talked about, which I think is a major aspect of being a trailblazer. And I see so many trailblazers sitting there on the panel. Paul has been doing this so much longer than we have. And, I feel like, I'm just so grateful that we can kind of pick up the baton and continue this movement, to continue this advocacy, following patient needs as nurses or retired nurses. We're always going to be nurses, no matter whether we have a license or not. And so I feel like it's just so important that we continue this legacy, and bring in the psilocybin and bring in our knowledge of how things have progressed in the cannabis industry and the gaps in our patient care, and ensuring that our facilitators are well educated. I just feel like education is so key. If we can educate our practitioners, we can reach so many more patients than trying to educate one patient at a time. Yeah. So I feel like it's this really collaborative effort that we're all putting in. And just knowing the positive impact, having experienced those impacts ourselves, we can really bring that experience to our patients. And that's so important. And in my life, especially, cannabis has been such a wonderful tool for alleviating the PTSD of being an autism parent. Our trauma levels are likened with that of combat soldiers, especially when our kids have a behavioral crisis in puberty, which is about half of the time. So it's a very common occurrence. So many families are in crisis, and they find this easement with cannabis therapy. And I look forward to integrating psilocybin therapy too as I learn more about it. I'm not a personal psilocybin user. I have a lot of sensitivity to anything fungus, so I just haven't ventured into that world. But I feel like it's definitely something that offers a lot of benefits to our patients, and I'm all for supporting patient access and patients having the support they need to really get the most of this therapy.
I am very much with you on that, Jana. I grew up with getting the needles in my back to discover that I was allergic to mold. So, working in a mushroom grow facility, combating mold, and, mold is our enemy. It took a lot of struggle and strive to, get over those fears. Jeanette, I wanted to ask you, when it comes to being present with your client, what's that look like? She was saying one meeting. Is that enough?
I mean, people have very different ideas about that. People work differently. And I think it really depends on the client that is coming in. People come in with different baggage, let's say, with different intentions. The way that I work with my clients is a little bit different. I spend a lot of time with clients. I usually see a client for 3 to 5 days. And then in addition to that, I also meet with them over Zoom or other, platform for several hours, to do a proper preparatory, intake. I want to see my clients in different contexts. I want to really get to know them and for them to get to know me, because I believe that the therapeutic function is really there through the relationship. It is through psychological safety. Now, some people will be able to achieve that psychological safety pretty quickly. They might be more trusting, just dispositionally. They may have suffered less traumatic experiences than maybe some other folks. And then, I work with a lot of combat veterans and first responders and people with complex PTSD. For many people who have gone through so much trauma, what happens is they're not able to just drop into that psychological safety right away. And so it really does take quite a bit of time, and I feel like it's really important to honor that and to give them that support.
Definitely giving them that space. Yeah, and that's, why we're creating this space here, CybinSpace. We invite you folks to join some of our Zoom calls. We're going to be continuing this discussion, discussion with people on our panel, people who are, on the ground floor here in Oregon, creating the space, creating the service centers, and really, generating what psilocybin services are going to look like rolling out in the next few years. I want to thank everybody on our panel for joining us. Thank you, Matt. Thank you, Paul, Jeanette. Thank you, Tone. You guys have been wonderful. Thank Janet Champagne and Heather Shelton. We really appreciate you guys tuning in to this program. Make sure to find us. pfatrade.com is a great site. Make sure to check out Open Signal. And, our goal, as always, is integrating our true selves with our daily selves. You have a great day.